almost so obvious that people are like, "Well, I know it, but I can't
Yeah.
do it." And then there's that accountability, there's that hand-holding of a dietitian or a healthcare professional who is helping you through that process and breaking it down and making it, applicable to you in your life. So what does
And
that look like? What does that behavior change look like for someone that you're
yeah,
helping?
so I do think that education still forms part of the puzzle because like if I use my PCOS patients for example, like often when I first talk to them and like get to know them, what I try to explore is like what do they know about their health condition, and some of it is education around what does it mean to have PCOS and how what's going on in your body, and what have you done so far in your life to get to your behaviors at the moment, and how does nutrition fit into this kind of puzzle? What factors will influence the underlying mechanisms of your disease, whether that's PCOS or if we're talking about infertility, what's causing your infertility, or endometriosis, you know, trying to figure out, okay, well, maybe we're thinking about inflammation, or maybe we're talking about insulin resistance, or, high hormone levels, or what is the underlying mechanism, and how does diet actually influence that? Because if you don't understand, you're less likely to actually make a change, because you're like, well, what's the point? Okay, yeah, I need to eat healthy, but what does that really, like, what's it going to do for me? So understanding, okay, why am I telling you to eat lots of oily fish, or have lots of fruits and vegetables that have got loads of antioxidants, anti-inflammatories? What is it going to do to my health condition? How am I expecting that to make a change and improve what my symptoms I've got, or just generally your PCOS or infertility? So I think in order to change your behavior, there is a piece of education and understanding, which you don't tend to get that personalized education piece, right? You can look up what happens in PCOS, but maybe you haven't had someone sit down and go through your blood test results and say, okay, right, you've got signs of inflammation, or you've got, some insulin resistance going on here, but or it might be that they don't have any of those things and it's just their menstrual cycle they want to make it much more regular, and they're trying to conceive. So tailoring it to the person that comes to see you and saying, right, these are evidence-based ways that we can help this specific symptom, or whatever the goal is that they're trying to achieve.
Hmm. Yeah, it is that application and breaking down, and the understanding is, I think that's such a good point of, we can know the theory, but actually, why does it why is it going to make a change for us? Why should we care about it? Then suddenly it is that reason, and it's that irrational subconscious part of our brain that needs to have that answer, or it's just going to go, well, I don't really care. I'm going
the
to
other
carry on doing
piece
what I'm doing.
the other piece that I didn't really talk about is like being ready to change. Like, just because somebody tells you, okay, so you get diagnosed with PCOS and you go see a doctor and say, okay, right, you need to lose weight or you need to change your diet. Just because someone tells you to do it doesn't mean you're actually ready to do it in terms of, your internal systems and your motivation, right? And just helping people to explore what's important to them. I think this is something also that's really important, that it's not often seen as dietetic work, but like getting people to reflect on things like their values, like what kind of person do they want to be? What's important to them? Is their health important? Is it actually that they want an easy life? And, if they can't be bothered to change anything because actually going out, socializing, and this, that, and the other is much more important to them, then you have to help them explore, well, what would it look like if maybe we changed the perspective, and maybe we put our health a little bit higher on the priority list, like, or what if you didn't, like, in the long run, what's the impact? So trying to explore people's beliefs, their values and their priorities in life helps them to figure out whether they're ready to change or not, and maybe just gently moves them through that kind of stage of change.